I'm going to talk briefly about the links between exercise and sleep. One of the most common complaints in patients who have long COVID or chronic fatigue and many other medical conditions is unrefreshing sleep. So patients will often report that they will fall asleep okay, they will sleep through the night, but when they awaken in the morning, they will feel as if they haven't slept at all. This can obviously have a very negative impact upon the ability to function during the day. It is very well described, but not very well known, that the autonomic nervous system has a very prominent role in the restorative nature of sleep. I have explained the basics of the autonomic nervous system in another video, and it might be a good idea to have a quick look at that. But just as a reminder, the parasympathetic nervous system is responsible for conservation of energy. When you fall asleep, the parasympathetic tone should increase, and the deeper the sleep is, the greater that increase will be. It has been demonstrated in people who report unrefreshing sleep that their parasympathetic tone does not increase sufficiently overnight. Now, there are many factors that can contribute to that. For example, stress, drinking coffee late in the evening, looking at computer screens, being very active right before you go to bed can all impact sleep. And these factors are taken into account in the concept of sleep hygiene. But that aside, something that can increase your parasympathetic tone in a long-term fashion is regular aerobic exercise. It has been demonstrated that patients who report poor sleep quality and then engage in an aerobic exercise program for a period of 2 to 3 months will often report improvement in their sleep quality at the end of the period of time. Another tip is that exercise also increases your energy expenditure. And if you expend more energy, you may just be more tired by the time you're going to sleep at night. Exercising early in the morning can be of benefit if you have time for that, because it'll increase your body temperature a little bit, and this can help to reset the sleep-wake cycle. Exercising outside and exercising with others can also be of benefit. So there you go, yet another reason to increase your physical activity. I will mention one caveat before I finish, which is that exercising right before you go to sleep may have a negative impact upon your sleep, because you'll be activating your sympathetic nervous system, and it is just quite difficult to fall asleep with an activated sympathetic nervous system.